Hey there, before we talk about types of ART, do you know what is ART? ART refers to a medical technique used to induce pregnancy. These sophisticated treatments entail altering gametes or eggs and sperm in order to increase the likelihood of conception. ART is often used to a person for whom previously infertility treatments has failed, or for those who have tried treatment but not been successful. People considering ART will frequently consult with the healthcare expert and may require the services of fertility specialists.
Intrauterine insemination, or IUI, is a fertility treatment that involves injecting male sperm inside a woman's uterus to facilitate fertilization. During IUI treatment, a catheter is used to inject sperm directly into the uterus. This treatment is an attempt to increase the probability of conception by increasing the number of healthy and functional sperm that enter the fallopian tubes when the woman is most fertile. So, IUI treatment is helpful for several groups of people that have problems conceiving a child. Firstly, when there is a problem in sperm delivery, the male partner cannot become or stay erect or is not able to ejaculate effectively. Secondly, when the woman has cervical scar tissue, this is due to the past surgery procedures which may hinder the sperm's ability to enter the uterus. Next, sperm disorders which include low sperm count and low sperm quality. IUI procedures consist of egg making, egg tracking, sperm rinsing, insemination, and lastly, the subject of IUI treatment or the woman can test their pregnancy by using pregnancy kit. So for the first procedure of IUI treatment is the ovulation stimulating medications may be taken by the woman. For example, the intake of clomiphene citrate, which is one of the ovarian stimulators for egg making. Next, careful monitoring is necessary to determine when the eggs are mature using imaging techniques. After that, the semen sample is rinsed in the laboratory to concentrate the sperm and remove the seminal fluid. If the seminal fluid is not removed, it can cause severe cramping in the woman. Typically, the duration of this procedure may reach 2 to 2 hours. IUI treatment usually is carried out just before the woman's ovulation. Also, the injection of sperm, which involves basic steps and only takes a few minutes, will be conducted once the rinsed semen sample is prepared. Next, the subject, which is the woman or patient, will lie on an examining table and the gynecologist in charge will insert a speculum into her vagina to examine the cervix. A catheter is used to insert through the cervix and the rinsed semen sample will be slowly injected directly into the uterus. After a few days, the patient can test for a pregnancy by using a pregnancy kit or visit clinics nearby. Moving on to the next slide, the success rate of IUI treatment depends on several factors. Firstly, unexplained fertility recorded 7% to 10% per cycle. But when combined the treatment with fertility drugs, the success rate can increase from 15% to 25%. Besides, male factor infertility such as sperm disorders recorded a percentage of 16.9%. In terms of age, under 35 years, the IUI success rate is 13%. In the age range of 35 to 37 years, the success rate is 10%. Lastly, patients aged 38 to 40 years, the success rate for this treatment is 9%.
Next, let's move on to IVF. IVF. What is IVF? IVF is a short form for in vitro fertilization. In vitro fertilization is a procedure that involves retrieval of eggs and sperm from male and female and placing them together in a laboratory dish to facilitate fertilization. Fertilized eggs are then transferred several days later into the female's uterus, where implantation and embryo development will hopefully occur just as in a normal pregnancy. There are several procedures for IVF, such as ovarian stimulation, oocyte collection, fertilization, embryo development, and embryo transfer. Firstly, the egg production will be stimulated by hormone therapy. Then, the produced eggs will be retrieved from the ovary and will be combined with the sperm sample that provided into a petri dish in order to allow the fertilization. And in several days after the eggs has been fertilized, it will be introduced into the uterus. There will be luteal support and pregnancy testing. Afterward, the embryo transfer. There are several types of infertility that can be treated by IVF, such as severe fallopian tube blockage, ovulation problem, diminished ovarian reserve, poor egg quality, polycystic ovary syndrome or PCOS, and lastly, endometriosis or insurmountable sperm deficiencies. Here are the costs of IVF. It could reach 10 to 15,000 ringgit per cycle, and the insurance claim up to 15,000 ringgit cumulatively, and the hospital installment plans could be from 6 to 12 months. Here are the factors affecting IVF success rates, such as age of the patient, ovulation dysfunction, type of fertility issue, duration of infertility, lifestyle factors, and quality of eggs or sperms.
In ZIF, the fertilized eggs at this stage will call zygotes, and they are placed in the fallopian tubes within 24 hours. In GIF, the sperms and eggs are just mixed together before being inserted, and with luck, one of the eggs will become fertilized inside the fallopian tubes. The processes used in GIF and ZIF are closer to natural conception. GIF, the fertilization occurs naturally within the female's body rather than in a petri dish, while in ZIF, the eggs are placed in the fallopian tubes rather than directly in the uterus. In GIF, the actual fertilization cannot be observed because the eggs and sperm are united for fertilization inside the woman's fallopian tube, while actual fertilization of the eggs in ZIF can be observed and confirmed in the laboratory. ZIF has advantage over GIF because ZIF use zygotes instead of an egg and sperm mixture, while in GIF, the sperm and eggs are just mixed together before being inserted. This figure shows an example of GIF. The sperm and eggs will be mixed together and placed in fallopian tube. the fertilization will occur in the female's body. While this figure shows the process of ZIF, firstly, the eggs are collected after ovulation or directly from the follicles. The sperm are collected and concentrated by removing the seminal fluid. Both the collected eggs and the sperm sample are mixed in a petri dish to allow fertilization to occur. Next, the fertilized zygote is then removed from the petri dish for implantation. The zygote is then surgically implanted into the endometrium of the uterus. After successful implantation, the zygote should develop normally as if it had been fertilized in the female's oviducts. GIF and ZIF can be used to treat many types of infertility, including when the IVF is failed. Females with one good fallopian tube can use GIF and ZIF except in cases when there is damage or abnormalities of the fallopian tubes. These techniques can also be used in cases of mild male infertility, such as low sperm count or poor mortality of sperm. GIF and ZIF also can be used to treat unexplained infertility. Intracytoplasmic sperm injection, or ICSI, is an effective treatment for men with infertility. It is performed as part of in vitro fertilization (IVF). During ICSI, a single sperm is injected directly into the cytoplasm of the egg. Some men may need their sperm to be surgically extracted first. ICSI is needed in a condition when the male partner produces too few sperm to do IUI or IVF. Besides, if eggs have not fertilized by traditional IVF regardless of the condition of the sperm, the person may use ICSI to treat. If there is a blockage in the male reproductive tract, it may keep sperm from getting out. Male with problem that the sperm cannot move in a normal fashion or the sperm may have trouble attaching to the egg also can use ICSI to treat their infertility. Ovarian stimulation. Ovarian stimulation consists of administering hormonal medication to the woman so that more eggs can be obtained. Then, follicular puncture is the process by which the eggs are extracted to retrieve the egg. Next is the oocyte denudation. Once the eggs have been obtained, the cells surrounding them are removed to facilitate micromanipulation and to better access their maturity. And lastly is semen preparation. It will consist of capacitating the sample and separating the best spermatozoa for microinjection. At this point, it is important to mention that if sperm cannot be obtained from the male ejaculate, they can be obtained by testicular biopsy or epidermal aspiration.
Cloning is defined as making a copy of a gene or entire organism from DNA from existing individual. Cloning is an assisted reproductive technology which can produce offspring that are genetically identical to the single donor animal. Clone is animal resulting from SCNT, which is somatic cell nuclear transfer. It is the fusion of the nuclei of diploid donor cells with unfertilized denucleated oocytes. However, there are many legal and ethical issues of cloning. This is the example of an ethical problem. Dolly is the first ever cloned mammal. She was cloned by using the process of nuclear transfer from a cell taken from a mammary gland. Cloning presents a moral issue that must be studied from the standpoints of many different disciplines. Some of the agricultural applications of cloning are genetic replica of an ancestor, rapid distribution of genetics, genetic improvement, and lastly, conservation of genetics. To make a clone, scientists transfer the DNA from an animal somatic cell into an egg cell that has had its nucleus and DNA removed. The egg develops into an embryo that contains the same genes as the cell donor, then being implanted into an adult female's uterus to grow. There are three types of cloning. Firstly is DNA cloning. It is about transfer of DNA fragment of interest from one organism to a self-replicating genetic element such as bacterial plasmid. Second one is reproductive cloning. It is making new genetically identical copies of an organism by using its own DNA. It creates identical to it and born years later. And lastly is therapeutic cloning. It creates embryonic stem cells. Researchers use these cells to grow healthy tissue to replace injured or diseased tissue in the human body. Lastly, for the conclusion, while most people use art to treat infertility, others may take it for genetic reasons or to avoid pregnancy risks. Art is also known as fertility treatment or medically assisted reproduction by some people. Due to the high expense of reproductive treatments such as art, many people may find it challenging to obtain fertility service such as art due to the high cost and limited coverage by private insurance and Medicaid.